The Memokath dual cone is going to be used today to treat obstruction in this kidney and also to try and save the kidney in the longer term. The obstruction is in the upper mid-ureter, and this is very difficult to try and repair for her with the normal means. The expected result in this lady is going to be very good. Memokath dual cone is a durable stent, and as it has been demonstrated before with Memokath 051, the durability of this stent is long-term, and there is data that these stents have been in use for more than 10 years with minimal incrustation and minimal side effects to the patient. I would like you to take part in insertion of the Memokath dual cone and the treatment of this lady with the long-standing obstruction of this kidney. As you can see, we are preparing now for the procedure. The cystoscopy is done first. We will use normal saline as part of the irrigation fluid, and we will get the II into place. Now you can see me doing the cystoscopy, and we have identified the ureteric stent. We have grasped the stent, and we have removed the stent. Now we're getting ready for the retrograde pyelogram. As you can see here, this is the ureteric orifice, and we are doing the retrograde pyelogram at the moment. And as you can see here, this is the level of the stricture. These are the two levels that the stricture has been marked, the proximal and distal end of the stricture. And now we will use needles to be put on the surface of the drapes to identify the length of the stricture. First needle is in place, second needle is in place, and we can verify that on the II. You can see now the length of the stricture on the II, and this is a decent length stricture. Now we are doing the measurement, and this measurement is going to be very important that it's done accurately, because this is going to determine the length of the Memokath that we will be using. We have determined the length of the Memokath that we will be using in this case, and now we are opening up the packages. This package, we have the ureteric sheath dilator. We will immerse the ureteric sheath dilator in the water, and also we will use some KY jelly to apply over the sheath so that slides easily over the guide wire. I am now passing the sheath over the guide wire. This is all done under image intensifying guidance. You can see the sheath progressing above the proximal end and the distal end. And now I'm removing the inner part of that sheath, and this is very important. As you can see here, the sheath is coming out, and you can see the urine coming out from the ureter. This step is very important because you know that you are in the right position. Now we are ready to deliver the Memokath dual cone. We need to open up the clips that hold it in place. I just want to show you here the Memokath dual cone. This is the metal component of the stent. Once the hot water passes through and the stent expands, then this component will be removed. Now we are about to insert the Memokath dual cone through the sheath, and this is being delivered. As you can see here, the Memokath stent is in place, and it is above the proximal needle. It is very important that the actual stent is positioned above the level of the stricture. We need to have the warm water ready. This has to be measured with a thermometer. We have the hot water drawn into our syringe. Inject the hot water through the proximal end, and this will lead to the expansion of the upper part of the ureteric stent, as you can see here now on the II. Now, once we have expanded the proximal end of the cone, we then deliver hot water through the side channel again and this will cause the expansion of the distal end of the cone. As you can see now, both ends of the stent are expanded and the stent is in good position. We will now do the retrograde parallelogram and look at the position of the stent and confirm that everything is in a good place. And the procedure is completed. Side effects from the normal stent are that they can get stent irritation, they can get infections of the stent, and also patient can sometimes develop incrustation of the stent. With the Memokath dual cone, we would be overcoming those side effects. A patient will have no irritation in the bladder since the stent does not reach the bladder. And also the procedure is a long-standing treatment option for the patient without having to have recurrent procedures. The Memokath dual cone is a titanium nickel alloy which is heat sensitive, and when we insert the stent we use a temperature of 60 degrees to be able to expand the two cones. The two cones will allow the stent to be kept in place and also minimize the possibility of migration of the stent. I feel that for this particular patient the best option was to use a Memokath dual cone. This lady has had leakage from the ureter, she has had fibrosis, she had major surgery in this area with significant fibrosis resulting to the ureter. The Memokath dual cone should last well over 10 years for her. The way that we would need to follow her up is to have regular checkups, and also we would need to do follow up with a CT scan, DTPA scan, and in the future ultrasound to make sure that there is no advancement of the fibrosis, and also to make sure that that kidney is draining well. I have followed the patient up after she's had the dual cone Memokath insertion, and after 6 weeks of treatment she's doing very well with minimal side effects and no irritation of the bladder and no symptoms in regards to her stent insertion. She does not have any pain, and she is very happy with the result. Thank you for watching this presentation, and thank you for your attention. I hope that the Memokath dual cone is going to provide you with an extra solution for the difficult patients that have problems with obstruction of the kidney, either for malignant disease or difficult cases with benign disease.